Well, thank you for having me. It's a pleasure to speak today and learn a little bit about kind of what you experience and how we as providers can be helpful. So first I wanted to kind of get a sense of who I have in the audience. Who of you have a child in your life that is affected by epilepsy? Okay, and who wouldn't fall into that category as either an adult or has an adult family member with epilepsy? Okay, all right. So most of what I'll be talking about is kind of geared towards the pediatric side of things and how neuropsychology can be helpful, but I will definitely try to hit on more broad topics that would apply to the adults in the room. Anyone in the room with a child who's actively in the process of trying to get school accommodations through an IEP or a 504? Okay, excellent. So we will definitely talk about that. And feel free to find me at the break and we can chat more if you want. So first to tell you a little bit about what a neuropsychologist does. So first and foremost, I'm a clinical psychologist who works primarily with children. Neuropsychology is really kind of a specialized branch within psychology where we're trained to work with children and adults who have a brain-based disorder that may impact their development or their cognition or their behavior in some respect. All right, so first, just to give you an overview of what I want to try to talk about today. I have more slides than I will have time to get to, but this is kind of the roadmap. So first, I want to talk about what does cognitive development look like over the course of the lifespan, what impact of seizures can have on cognitive development, how a neuropsych evaluation can be helpful, and then how to get help at school. All right, so thinking about cognitive development over the course of the lifespan, I think it's important to note that this is a pretty prolonged process that happens really starting from conception is when brain development starts, and it continues all throughout childhood, really through adulthood and even through early adolescence. So within the first year of life, we have rapid development in systems responsible for kind of fundamental skills like motor systems and sensory perception, those types of skills that really lay the foundation for the development of more complex skills like language and problem solving and higher order thought. And as you can see, there's kind of a progression that happens with these things where even in adolescence, we're having a significant amount of development. So, oops, I think I'm gonna skip over that slide. All right, so thinking about what happens when kids enter school. So around the age of 3 is usually the first time that a child would be entering some sort of structured learning environment, whether it's daycare or preschool or later on in kindergarten, thinking about kind of what cognitive skills they're showing at that time. Oops. I think I missed one of my slides, but essentially, really early on, children show fundamental sort of early skills with attention and with self-regulation that really set them up for being able to engage in a structured learning environment in a meaningful way. Let's see here. There's also a number of kind of social and emotional developments that happened at that time that allow kids to be an active participant in their learning environment and to kind of engage in school and learning in a meaningful way. Now, executive function is that a topic that anyone has familiarity with, or you've probably heard this term a little bit? Okay, yeah, so it's a big kind of buzzword these days, and really it's kind of the brain's ability to act as the CEO or the regulator of cognitive processes, of behavioral processes, of things like emotion regulation. And so around this time, around the age of 3 to 5, we start to have some initial sorts of hints of these skills beginning to form. So some of the fundamental skills related to executive functioning are things like being able to control impulses, being able to hold information in your mind for a short period of time and to do something with that information. It involves being flexible in the face of changing demands. And so even when we test children as young as 3 years old, they show some kind of precursors to this. An example of kind of early executive functioning would maybe be the game Simon Says. So around the age of 3 to 4 years old, kids can hold a simple rule in their mind and pay attention. It's really until the age of 4 to 5 or 5 to 6 that they're able to kind of inhibit that rule and switch in the face of changing demands. So instead of copying everything I do, I have to inhibit the impulse to do that and to kind of develop sort of a different way of responding. So the way executive function develops over the course of childhood, the part of the brain that's responsible for these functions are largely what's called the prefrontal cortex. And it's an important part of the brain because it's highly interconnected with other regions of the brain, and it really has a prolonged course of development. So that first graph I showed you, this is definitely one area of the brain that continues to kind of form connections throughout adolescence. It becomes more efficient over time in its ability to kind of transmit information. And so even when we have a child who's 16 or 17, this part of their brain is still developing, which is maybe can help explain some of the adolescent behaviors that are typical. This is kind of a difficult slide to see, but I think it demonstrates that there is a trajectory of these skills over time. And so there's school is definitely one opportunity to hone these skills a little bit, but a lot of these skills and this learning happens outside of school, and I'll talk about that later on. Middle childhood, in terms of cognitive development, you really see some significant improvements both in executive function and in memory. Kids are able to kind of engage in learning in a more strategic way, and this really helps kind of develop their knowledge base and the amount of information that they can retain. At the same time, there's a number of social and emotional milestones that are happening. Children are getting a better sense of who they are in the world and are more aware of kind of their peers around them and what other people think of them. And I think that's an important thing to think about as we move into talking about accommodations and certainly what it's like to live with epilepsy. So what does this look like in kind of a school setting? Do I have any educators in the room? Okay. All right, so in elementary school, we really have what is called kind of a focus on foundational learning. So the goal of probably kindergarten to third grade is really mastery of basic skills, reading, writing, mathematics. Around third to fourth grade, there's kind of this fundamental shift in learning those rote skills to being able to apply those skills in a more meaningful way. So I like to say that first to third grade is kind of learning how to read, and third grade is you're reading to learn. So you're expected to kind of use those basic skills to derive information from material. And so I see quite a few kids who do really well in those first to third grade years, and when that kind of shift happens, it's more difficult, and they start to kind of have more challenges that are sometimes unexpected. All right, so adolescence. We know there's quite a bit that happens cognitively, physically, emotionally during adolescence. While we do have some skills that are at adult levels in terms of attention and being able to hold information in mind, there's still a significant amount of growth that needs to occur. So thinking about kind of executive function in terms of emotional control and behavioral regulation, we know that during this period, individuals still have difficulties kind of being able to think in the long term, to kind of weigh long-term consequences versus immediate rewards. And so this is definitely one of those areas that is going to continue to develop even into the college years. All right, I like showing this comic strip. Is anyone familiar with this? It's called Zits. I think that this comic strip got my parents through my adolescence and my brother's adolescence. I'll still go home and my mom cuts these out and puts them on the fridge just because they're too perfect and exemplify things that she had to go through with us. So, all right, in middle school, there's certainly a huge paradigm shift from elementary school, right? You go from having one teacher to having multiple teachers. And the demands for organization and kind of independent study really increase dramatically. And so if you don't have those foundational basic skills in place, it becomes increasingly harder to be able to keep up with both the pace of the work and the complexity of the work. High school is just a continuation of that, with subject areas becoming even more complex. And there's also kind of the shift that happens where kids have better insight into what is easy for them, what is hard for them. Hopefully they're engaging in some sort of metacognitive processes where they have some understanding about what they can do to kind of help compensate for things that are more difficult for them and how they can use their strengths. And that's something I talk to families a lot about, is that school is not just about learning academic subject areas and mastering knowledge. It's about learning how to do that and developing study skills to do that that are going to make you successful for either college or a job or whatever it is you're wanting to do. All right, so let's talk a little bit about seizures and the developing brain and kind of what that looks like in terms of cognition. So I think, building on the point that seizures are very variable and there's no kind of single pattern that we can see, there's a lot of variability in terms of what seizures can do in terms of learning and cognition. So for some individuals who have very early onset seizures, we can see a pattern of delayed development where they're maybe late to walk or late to talk, and they may receive some early intervention and are able to catch up and do pretty well. Some kids need a higher level of support for a longer period of time, and sometimes that support needs to continue well through throughout childhood and adolescence into adulthood. There's also, on the other end of the spectrum, people that have very minimal impacts from their seizures. In some cases, I work with families that kids are doing pretty well for several years, and then they meet one of those transitional periods in school, whether it's that 3rd to 4th grade transition or the transition to middle school or high school, and there's kind of this difficulty keeping up with complexity, and so that's kind of a pattern that is typical. In thinking about kind of how seizures impact cognition and learning, I think it's important to recognize that seizures don't occur in a vacuum, right? It's not just the impact of seizures on the brain, it's kind of what in the brain is maybe leading to the seizure, the things that are associated with that. So whether it's the actual seizure activity or some subclinical activity that's happening in the brain. If there's, in some cases, kind of an underlying structural cause for the seizures that are reflective of kind of differences in neurodevelopment, all the way to sort of behavioral side effects that can go along with medications. So there's really a, I think this kind of adds to the complexity in thinking about what we see and helps us understand why there isn't a single sort of picture. So with regards to academics, thinking about the cognitive areas that I covered, you can imagine that there's a lot of opportunities for seizures to impact how well kids do in school, whether it's impacting attention or those higher order executive skills, to being able to work quickly, to being able to encode information and remember it in a meaningful way. And then certainly for anyone with a medical condition, there's active time away from learning related to just medical appointments or needing to stay home from school or needing to go out of the classroom for whatever reason. Attention is kind of a big area. A lot of the kids that I work with have some sort of attentional impairment, whether it's very subtle or all the way to something that might be consistent with attention deficit hyperactivity disorder. And that can happen in a variety of ways. So certainly with some types of seizures, we can have attentional lapses, like with absence seizures, where even though your attention outside of that might be pretty good, it's hard to kind of get back on track if you have interruptions in your ability to understand and maintain attention during the classroom. Even outside of seizure episodes, though, we see that a lot of kids have difficulties just maintaining their vigilance. So staying alert, being able to focus for long periods of time, or being able to work quickly. And then, as I mentioned, there's a pretty high overlap in terms of the number of kids who have ADHD and kids who have epilepsy. So about 40 to 50% of children who have epilepsy also meet criteria for the inattentive type of ADHD. And it can look a little bit different than what we might think of as typical ADHD, where you may have some hyperactivity or some impulsive symptoms or difficulties sitting still, working quietly, those sorts of things. What we more often see with kids in this category is that their ability to attend is not at typical levels. And so these kids can often fly under the radar because they're not speaking out in class, interrupting, doing kind of disruptive things. It's more kind of a subtle disengagement of that attention that can really impact learning. We know that children with epilepsy, there's a higher rate of specific learning disabilities, whether that's something like dyslexia or a reading disorder, a math disorder, or writing-based disorder. We know that those things just occur at a higher frequency than the general population. And then, as I was alluding to earlier, sometimes we see this pattern of being able to master those basic skills, but when the demands get more complex, that's where some of the difficulties start to emerge. This was a study that followed around 200 children with various types of epilepsy and their siblings, and they were followed over the course of 3 years. And they looked at reading and math skills at the time of diagnosis and then 3 years later. And I think it's a neat study because what they're doing is they're comparing children with seizures to their siblings. So the idea being that generally speaking within the same family, there's a similar level of learning achievement and cognitive abilities between siblings, and so the siblings kind of serve as a control for those kids who have epilepsy. And what we see over time is that the kids with epilepsy are not able to kind of maintain skill growth at the same level as their siblings. Memory is one that comes up a lot. I think this is kind of a difficult question to answer because a lot of times what are perceived as memory difficulties relate to maybe poor attention and difficulties organizing that information in a meaningful way. This is pretty common in kids that I work with to have some executive function difficulties where depending on how we test their memory, if we test it in such a way that we kind of get rid of some of the difficulties that they might have with encoding and storing that information, organizing it, we can see that they do actually retain it, but it's a matter of how we test it. So that's really meaningful for knowing in classrooms what's going to be the best way to assess that child's knowledge. We know that some types of seizures and some syndromes have particular difficulties with memory, particularly individuals who have temporal lobe epilepsy can have specific memory impairments. All right, and then there's the impact just on you as a family in dealing with controlling seizures and monitoring seizures and medications and medical appointments. And we know from the literature that caregiver well-being is very predictive of kind of how the family is doing and how parents perceive their children. And so it's really important that the caregivers are supported in all of this too. All right, so I want to move a little bit into what the neuropsychological evaluation does and what to expect. So the goal of this is really to help you understand your child better, or yourself if you're going through the process yourself, by understanding kind of cognitive strengths and weaknesses, the extent that seizures and other medical factors are contributing to cognition, and then the big point of this is what do we do about it? How can we help? So some of the referral questions that I get commonly are maybe it's initial evaluation to just understand where a child's developmental or cognitive abilities are at. Maybe it's clarifying a diagnosis. Maybe there's a suspicion of a learning disability or ADHD. Maybe it's parsing out what is kind of an emotional behavioral issue versus something with underlying cognition that might be contributing to that. We often see children who are maybe in the process of being worked up for a surgical procedure to understand how their brain is sort of organized and the impact that surgery might have on them and how to kind of tailor interventions after the surgery to support their learning. So has anyone gone through neuropsych testing or had a family member? Okay. So you know that it can be a very long day, full disclosure, for both you and your child. Generally what the process involves is doing some sort of diagnostic interview or an intake where a pretty comprehensive interview is done about your child's development, the current challenges that they're having, what school is like, what they're like personally and emotionally, really kind of putting all of this into context. After that, the child goes through some testing. I like to call it brain games and de-emphasize the word testing because I think it can be scary. Most kids find that it can be a fun and challenging day. The nature of the tasks are such that they're pretty short and they change fairly frequently, but it is a long day, and I think it's important just to be prepared for that. At the end of this whole process, the person that you would be working with would give you some feedback about what the evaluation found in terms of cognitive strengths and weaknesses, if there's a particular diagnosis that may apply to your child, and then what to kind of do about that. So I would recommend, if you are close in the process of getting an IEP or a 504 started, to kind of do this fairly early on. So you want to have the testing done well in advance before you have the IEP meeting, so that the report can be done and can be given to the school to kind of incorporate that into some of the decision making. There's several domains of function that we look at as part of a neuropsych evaluation. One is just kind of general cognitive ability, or what we would refer to as IQ. But we also look at other areas that help us understand how children learn. Are they someone who learns best from verbal information versus visual spatial information? Are they having difficulties with writing because they don't know how to construct a sentence versus is it just the mechanics of writing that is not their strength? We also, of course, look at domains of memory and attention, academic performance, and then putting it all into context. What is that child like? What are their personality characteristics? Are they one who does really well with persisting through difficult tasks? Are they more likely to get frustrated? All of these things kind of help paint a picture for what is going to be helpful in school. All right. So I think I touched on most of these points. Part of what neuropsych does is generate these scores about performance, which I think can be kind of daunting. But the scores aren't designed to kind of limit or decide what an individual can or can't do. I like to think of it more as what level of support is going to be helpful for that child depending on what the tests show. And so the neuropsychologist working with you should really kind of talk to you about what are your goals for your child, what do you want to be seeing them achieve, and how can we help them get there in light of kind of the challenges that they may or may not be having. All right, so some specific things that can come from the evaluation in terms of recommendations. So you have all this information, you've spent all these hours doing the testing, what do we actually do next? So this is an example of kind of some detailed recommendations depending on the pattern of results that we might see in testing. So for instance, if attention is a big issue for an individual, maybe putting some supports into their IEP or their 504 regarding being seated at the front of the room, away from noisy peers, maybe giving them more opportunities to learn information, because we know that if you're not paying attention or you have difficulties paying attention, that hearing that information more than once and in different ways can be very helpful. Some of those sorts of accommodations can be done in the school, in the classroom setting, but a lot of these are going to be helpful for what you do at home, at homework time, in terms of how does your child best learn. Sometimes we would recommend things at a higher level of intervention, so maybe their needs are such that being pulled out of the classroom and having some one-on-one instruction would be helpful. Maybe working with someone like a speech pathologist or an occupational therapist, depending on the difficulties that might be there. So there's really kind of a whole host of things that can be helpful. This is just some common ones that we tend to use. All right, so what do you actually do with that information? How do you get support at school? So there's kind of two broad categories of supports that can happen in the public school system. So the first one is based off this special education legislation called the Individuals with Disabilities Education Act, or IDEA. And basically, what it provides for is for children who meet criteria for one of 13 disability categories, they are entitled to have some services within the school setting that are above and beyond what they might get in the general education curriculum. And so the way that the eligibility for this is determined, there's a pretty comprehensive process that takes place in the school. There's often review of medical records, neuropsych records, other academic testing that has been done by the school to determine if a child has a disability. So the disability categories are broad in some respects. Simply having a medical diagnosis can be a way to get eligible for one of those categories, but you can also fall into a category like a specific learning disability, an intellectual disability, and there's a couple of others. The second sort of category of supports that are available in the public school system are based off of this legislation, the American with Disabilities Act, what's called Section 504 of the Rehabilitation Act. And so essentially this allows for accommodations, but they're more in the context of the regular education classroom. So it's a little bit easier to qualify for these services just on the way that the disability categories are defined and the threshold for impairment that is necessary to get an IEP. They're really more kind of accommodations in terms of how an individual might learn rather than changing what the curriculum actually is. So side by side, this is what they look like. You know, an IEP, like I said, there's a pretty prescribed process in terms of what needs to happen at the school. There's an IEP team, which is composed of individuals from the school. You as a parent are a member of that team as well. I think that's important to keep in mind that you have input in this process. Usually what happens is you would request that an IEP be put into place, or an evaluation for an IEP would be put into place, and then that process takes a couple of months to complete, and at the end of it you sit down as a team and kind of decide what are the supports that are going to be written into the educational plan, and that is done every year. There's a more kind of lengthy reevaluation process that would happen every 3 years. Everything is written down. There's kind of specific goals that are worked into those into that plan to determine if the plan is actually helping, whereas a 504 plan is a little bit looser. The documentation is a little bit more informal. The child is usually not pulled out of the class for special supports, and the curriculum is not modified, but they do kind of have some supports in terms of how the information is presented to them. Maybe they get extra time for tests, those sorts of things. All right, so after you've done your neuropsych evaluation, you would take that report to the school. Depending on whether you've decided that a 504 or an IEP is going to be more appropriate, and that's a conversation that you can have with the psychologist working with you, what they recommend. You would kind of take two different courses of action. I like to recommend that anytime you're requesting something like this, you put the request in writing and date it so that schools have a written record of your request. That's important. And really early on, I would encourage you to find an ally within the school that's going to help advocate for your child. Whether that's a classroom teacher who kind of understands your child's needs, or maybe it's the principal, or someone at school that your child knows well. kind of helping foster that collaborative spirit early on is going to be really helpful in getting the supports that your child needs. So navigating the IEP process, once they've done the evaluation, which often includes some classroom-based observation, some of their own evaluation, reviewing outside medical records, they will put together a draft of what is going to be in the plan. And so before you go to the school to have that meeting, if possible, I would try to get a draft of that IEP so that you can review it ahead of time. It's usually a 20 to 30 page document with a lot of detail, and it takes a little bit of time to understand the jargon and what's going on. So if you can look at that ahead of time, it's really helpful. When you go into that meeting, I think thinking about what you want for your child, not just I think it's important to be kind of solution focused in going into that meeting. So if you come in kind of complaining about what the child isn't getting, I think it's much more successful if you can kind of come up with some concrete things that might be helpful in terms of interventions and supports. And that's certainly something that the neuropsych evaluation can help with to some extent. As part of the decision-making process that happens during that meeting, you certainly have input, and so it's okay for you to kind of advocate and ask questions and get more information. You have a say in that process as well. All right. So I think it's just important in thinking about that collaborative spirit of getting the supports that you need for your child, that the healthcare system and kind of the neuropsych report that's generated for your child versus how the school thinks about kids. So the two systems kind of have different ways to support kids and use different language in terms of understanding children. You know, over the course of a long day of evaluation, I really only get a snapshot into what that child is like and what might be helpful for them. The school really spends a lot of time with your kid and is going to have a better sense of what might be helpful. Are the recommendations that we're promoting, are those going to be feasible in this school setting? And so there's no one right way. I think it's kind of a blending of both of those things, and just kind of being able to navigate between both of those worlds is a challenge. But understand that the school, likely wants the best for your child too. They may just have differing opinions about how that might happen. So what to do if you don't get what you ask for? Keep trying. I would encourage you to talk to your neurologist or talk to the psychologist working with you for support or recommendations as to what might be helpful. There's some outside organizations. Fact Oregon is a great one. They have an excellent website that provides a lot of valuable information about the IEP process, the 504 process, kind of breaks it down into very simple language as to what are these services and what is my child entitled to by law. And then I think it's also important to just kind of assess your own expectations for your child. Keep in mind that the accommodations that a school can provide are not going to result in a return to typical levels of functioning in all areas. So they're really just kind of supports for your child to help them perform the best that they can. And so sometimes there's things outside of the school that are going to be helpful for that, whether it's some behavioral interventions with a therapist. For some kids, their difficulties with attention are at a level that a stimulant medication or an other type of medication might be helpful. So be flexible in your thought and how you think about that. All right, life after high school. Thinking about special education support, so unfortunately, the same laws that apply to K through 12 don't necessarily apply to universities. There are certain categories of an IEP that would provide transition planning up to the age of 22 for individuals that need a higher level of support. Maybe they need some independent skills training, or will likely need a guardian after they turn 18. Those services are available. But if you are graduating high school and going into college, it varies significantly from school to school. So all universities are required to adhere to the Americans with Disabilities Act, or a 504, but the way that's implemented and the supports are gonna differ quite a bit from location to location. So I think as early as kind of 11th grade, 12th grade, it's important to start talking to the college counselor at your school, getting a sense of what universities are out there, what services they offer, and then in terms of securing those supports at the time of enrollment, you would need to submit a copy of a report, generally done within the last I would say last 3 years, although schools differ, to kind of make the case for those accommodations being put into place. All right, and then just to close, I've kind of hit on this a little bit, but I think it's important to build these skills outside of school, right? So one of the big goals of school is just learning how to learn and learning how to self-regulate, learning study skills, and skills that are gonna be necessary for kind of having a job, going to college, or whatever it is that your child wants to do. And so there's certainly kind of home-based interventions that can be helpful with that. And that's something that you could work with a psychologist on. There's a number of excellent books that kind of teach parents how to build executive skills in their kids. And so if anyone's interested in those resources, you can come talk to me. All right. So I want to make sure I finish in time. What questions do you have for me? Yes. That is a great question for your neurologist. Well, I'm not the type of doctor who could answer that question. Generally,